Unlock the secrets of healthcare data innovation and witness the future of patient care unfold. Dive into the Health Data Forum, where groundbreaking advancements and cutting-edge insights await. Explore the transformative power of data to revolutionize healthcare delivery and societal well-being. Join leading experts, thought leaders, and innovators as they delve into the latest trends and challenges. Experience the collaborative spirit of a vibrant community where ideas converge and partnerships flourish. Participate in discussions, share your perspectives, and contribute to shaping a healthier future. Stay ahead of the curve with our comprehensive video library, featuring insightful interviews and presentations. Catch up on thought-provoking conversations and engaging discussions that keep you informed. Together, let's harness the power of data to transform healthcare for the better. Join the Health Data Forum's mission to make healthcare data work for everyone.
That we are going to host in the closing session. And with me already, I have the privilege to have two distinguished guest speakers. George Mathew is going to be sharing this session that's going to be on a distinct alternative than what we would expect for a closing session. So it's going to be a fireside chat conversation. And it's really a privilege to have a person like George Mathew as our executive chair of the advisory board of the Health Data Forum. And it's amazing that George could take the time to be here with us for this closing session as well. Obviously, of course, as Eric Sutherland, a dear colleague, and a privilege to have them both here. So in terms of George, Mathew is currently an assistant professor of medicine in Westchester Medical Center and is an affiliate on multiple venture firms that support the emergence of startup companies, and its advisor also in UMA. Is a seed venture investor himself and advisor on multiple organizations, and formerly a chief medical officer of Dedalus. George, the floor is all yours.
Obrigado, Paul. Thank you so much. Boa tarde, everyone. As Paul said, my name is George Mathew. It's my pleasure and honor to be here, and I'm equally honored to be introducing and discussing some of what we've talked about the last few days with Eric Sutherland. For those of you that don't know, Eric is, I'm not even sure, I'll start with being a multi-hyphenate. He's accomplished a lot in his career. If I look at any consistent themes throughout it, up to the point where his current role as the senior health economist for the Organization for Economic Cooperation and Development. I hope I said that right, Eric. The consistent theme is someone who is trying to champion the right thing for people so that they, especially when it comes to their health data, and trying to help. That is the foundation on which he has created a very storied and valued career in trying to help people understand health data and how it can be used in a proper way with governance and equality. Eric, I hope I've summarized it and I haven't butchered it too much.
I think that I am humbled by the introduction, George. Thank you. And obrigado, everyone. I use my one word of Portuguese.
You and me both, Eric. But one of the reasons that I think that Paul and others are very honored to have you here is, I believe as part of your role, you are encouraging digital health ecosystems to come to life. And you know, beyond being just, as you say, a data guy with personality, that encouragement requires fertile soil to work in. And I can think of no better than the EU and specifically Portugal to really build those type of ecosystems. Eric, I had a few questions that I wanted to kind of use to open up the discussion for folks to get an idea and understanding of how you are thinking of the frameworks that would help enable this, and more importantly, ways that they can, create action items from what they've been discussing in this several-day discussion of real-world evidence.
Yeah.
One of the first principles you discussed past is culture first, data tomorrow, and then AI next week. Can you elaborate a little bit for us, to understand where that came from and why it's so important to start with culture?
Sure, sure. And again, very, very thrilled to be here. And it started with a work that I was doing with a multinational group from all over Europe, all over India, and other words. And it's actually the place where I first met Paul, of all things. And their mission was data today, AI later. And so their focus was on, like, let's make sure we get our data houses in order, because data are the water to the AI taps and analytics that we actually have. But I realized something else within this in terms of the overall ecosystem. You need three things to come together, being you need the pipes, being the technologies that actually carry the water, the data from various facilities across our data and health data ecosystems, in order to actually get that appropriate water to the right place in the right time at the taps through analytics like AI systems to actually get the insights out. But then I got to another problem, which is it's all great to define pipes, water, and taps, but you need humans to actually define what the standards are for the pipes in terms of their width and thicknesses, and to define the water quality standards that we would have in the systems, and to actually make sure that we understand how the taps operate in the right place at the right time. And so all of those things need to come together, and we need people to do all of those functions. And the fundamental challenge that I've identified across many, many OECD countries is that the way that what they have been approaching the data opportunity and the AI opportunity has been focused on areas of, let's invest in the shiny objects. Let's invest in the nifty new tools that are coming out, as opposed to what are the things that are most beneficial for society as a whole in order for us to achieve our overall outcomes. And so there's a need to shift our thinking from individualistic and facility-based health systems toward true person-centric health systems, where, and it's not just in name, because like saying we want to do person-centric health systems, it's easy to say it, but it's harder to define it, and even harder still to actually achieve it. And the way that I think of that, simply put, is all of the data about an individual is available through a single channel. Now, that data may be dispersed across many organizations and available through various networks in order to pull that data together, but we need to be shifting our thinking toward person-centric data and information. But that requires a massive shift of our culture, because the way that we have done and funded our health systems have been based in facilities and hospitals and primary care and specialists. And because we've invested in it, and all those organizations have procured their own technologies, the data about the person is massively fragmented. So in order for us to get to a point of having data first, we need to address the culture that breaks the silos of the data assets that we have across multiple facilities. So that's what I mean by culture first. We need to break the silos to really agree that we're moving toward person centricity within our health systems with a data first approach. And then once we get there, then we can start to unleash and unlock the value of AI.
Perfect. Eric, as we were in the last discussion, there was a bit of talk, obviously, about consent and privacy. And, I think you and I had talked a little bit about this. In many cases, many nations, in fact, some companies feel that privacy is counter to innovation and technology and artificial intelligence. And as we start delving into more into real world evidence and the obtaining of that information, it just feels like that is getting more vocal and stronger as people are starting to build business models around this free access to real world evidence. Do you feel that this tension between privacy and innovation is accurate? If so or not, why? And how do you think it may develop and evolve in the EU and globally in the future as AI continues to be developed?
So I've been with the OECD for 2 years, and prior to that, I was doing a lot of work across Canada. And the major challenge that many innovators, many researchers, many health professionals kept on referencing was privacy as a problem, privacy as a challenge, privacy as a barrier. Pardon me. And the irony is that my first job in health, I was actually accountable for the Personal Health Information and Privacy Act in Ontario, Canada, which, per some of the discussion that was just had in the last session, is the origin of privacy by design. So I actually was working with the people who originated privacy by design in defining what that act is. But the challenge that we had and the challenge that we came to is that privacy itself is not the barrier, because many of the legislations that exist around the world allow the ability to access data when it is in the public interest. The challenge that we have is that the interpretation of these acts and the application of these acts don't actually follow through with what their plausible intention would be. And so many policymakers need to think about defining and how do you operationalize the definitions that you already have for things like public interest, to actually make sure that you're following through with it. And the way that I like to think about this problem, because as we all know, health professionals, they have a credo of doing no harm. And I think that as digital health professionals, we actually have the same credo of do no harm. But we need to recognize within that there are harms that come from the action of providing access to data, such as privacy breaches. And there are harms that come from the action of not providing access to data, such as preventing innovation, preventing discovery of cures for disease, or preventing bad drug interactions around an individual.
That's right.
We need to think about an overall holistic sense of what are the harms associated with the action of providing access to the data and the harms that come from the action of not providing access to the data, and then make a commensurate choice around that. And one last thing to say, privacy as an action itself does not add value. Privacy is a control that helps build trust. Access is the action that does provide value, because value comes out of the use of the data, not from the protection of the data. So our imperative should be to use the data first and make sure that as it's used, be protected. As one patient said to me in the UK, do not tell me how you are protecting my data. Tell me how you are using my data to improve health services, improve my health outcomes, and assure me that my data are protected along the way. But if you're protecting my data without using it, you're breaking my trust, as a matter of fact. So while privacy is intended to build trust, the over application of privacy does have the negative impact of decaying trust. And so that's why we need to think about it from a more holistic perspective around what are the harms and how do we minimize harms while we're optimizing outcomes.
Interesting. And very helpful too, as we start evolving the whole privacy discussion when it comes to health data. Sorry, go ahead, Eric. I didn't mean to cut you off.
No. I was just simply, it's like evolving. It's certainly with the whole European health data space, much of the risk that we have in Europe right now specifically is that we have 27 member states that are in process of interpreting the European health data space regulations and interpreting how they're going to apply it within their local jurisdiction. We already have 27 different interpretations of the global data protection regulations. I don't know what 27 times 27 is, but we're just going to have a massively confusing interpretation of how all these things fit together. And this is where I actually respect, I not respect is the wrong word. I appreciate what countries like Norway have recently done, where they've actually definitively said, we are creating an action plan at the intersection of privacy, data access, and artificial intelligence, so we can actually resolve these tensions that exist. Because AI wants all the data, health wants to protect the data. And so you need to have a specific approach at that intersection point between the two. And that's where I think Norway is on the right track by having defined it. I know many other countries are in process of thinking about the local definitions.
This is a great segue into kind of the last question I have for you, Eric, which is, as we start talking about, let's say, 27 different EU countries trying to interpret what the rules should be in terms of handling data, real world evidence or otherwise. Ultimately, we're going to have to have discussions about cross-border data agreements. And within the EU, amongst the different countries, and even outside the EU. I live in the United States, where we have hardly any rules and regulations, and we anticipate to be even fewer starting January 1st. So to make this work properly, because obviously when we start talking about data, specifically health data, what foundationally needs to change to make these agreements useful for AI work, and then meaningful so that each of the counterparties fairly and mutually benefits from the promise of data and healthcare.
So thank you. And this is a topic that is not surprisingly near and dear to my heart. I think that cross-border data collaboration is one of the things that we are not doing sufficiently within the EU, and certainly not internationally. But it is what the aspiration of the European health data space is meant to achieve. And so I think from a practical perspective, it's understanding what policies you have within your jurisdiction, and what are some of the things that within there that enable the ability to collaborate across borders, and what are the things that prevent the ability to collaborate across borders, and then check whether or not those things that are preventing that collaboration are actually what you mean to happen. So for example, I will in Denmark, one of their rules is that you cannot do analysis on Danish data unless you're a Danish citizen. And so now if you're actually a researcher outside of Denmark, does that mean that you always have to bring in a Danish person onto your research team, or are there other more practical things? When these rules were written up 10, 20 years ago, the world was different than it is today. Our ability to network, to collaborate across borders, the ease of collaboration across borders is way faster, way easier now than it was before. And the power of AI is unparalleled in terms of what potentially it could do. And so I think we need to revisit some of these rules that we've made in the past and work out, are these actually things that we did because of a certain time and place, or are they things that we want to actually change in order to enable greater collaboration? The specific thing that, and forgive me for the term, because it's not an English word, it's one that I made up, but I call it co-opetition. So we need to define what are the policies that allow for cooperation across borders. And that cooperation across borders means that our policies within countries need to be compatible with other countries. Doesn't mean it's the same. I'm not saying harmonized or anything like that. We need to make sure the policies are compatible so things can fit together, so we don't create massive bureaucracy that is unnecessary. And then once we have that strong foundation of our policies for data access and sharing, for our policies for our standards really for data content and standards and semantic interoperability, then we can actually drive our competitive instincts from an innovation perspective to actually do the competition on the innovation, but based on a common foundation. This is what, frankly, banks, this is what aviation, this is what consumer goods do. They agree on foundations. There's a reason I can take money out of any big machine around the world. There's a reason I can fly in airplanes and they can land anywhere in the world, because there is cooperation on those foundational things across borders. And then they compete on their service differentiation. From a health perspective, we need to think about that. What we have traditionally done is we believe that everything is competitive, or we act as if everything is competitive. Yeah. And what we need to start doing is thinking about what are the things where collaboration and cooperation actually makes it faster, better for me. And more to the point, if I'm person-centric, how do I create an environment which is actually a better, safer environment and more respectful environment for the public?
All right. Eric, thank you so much. At the brief time that you've had, you've kind of crossed quite a few topics and kind of educated all of us. I really appreciate it. I hope everybody else does too.
My absolute pleasure. I just think that this is near and dear to my heart, as you can probably tell. And I'm very, very happy to explore this. We actually have a report coming out next week on the perspectives of medical associations on AI, and what we discovered there, for example, because while I talk a lot about the public, we have to think about the providers too, because they have had a very bad experience with digitalization. We have an opportunity to improve it. If we could do like what the Netherlands have recently done, of declaring that they're going to reduce administration for health professionals by 50% in the next few years through a combination of cutting red tape and artificial intelligence. That is a very bold statement, but I think it's a plausible one. And so the report that we have coming out next week that talks about the perspectives of AI medical associations, what it simply says is that medical associations and doctors and health professionals aren't worried about AI replacing their jobs, but they are worried about AI being developed without their input and without their involvement. And so, and I would say that is one of the major lessons around AI, especially if we want to approach AI with dignity. Then how do we actually do so in a way that involves the people who are most impacted by the solutions, being health providers and the public?
Agreed. Eric, thank you so much for adding. I mean, this has been phenomenal to add this to what we've been talking about so far at the Health Data Forum Global Hybrid Summit. Paul, I wanted to pull you back in if that's okay.
Thank you so much, dear guest speakers. It was, I think, a round of applause would be deserved, if you may listen to the applause. True. And my hope is that next year, next edition of this summit in the spring, we will be able to be face to face with you and benefit from your experience and wisdom. It was amazing. Thank you so much.
The world was different than it is today. Our ability to network, to collaborate across borders, the ease of collaboration across borders is way faster, way easier. We want to actually change in order to enable greater collaboration. The specific thing that, and forgive me for the term, because it's not an English word, it's one that I made up, but I call it co-opetition. So we need to define what are the policies that allow for cooperation across borders, and that cooperation across borders means that our policies within countries need to be compatible with other countries.